Welcome everyone. In this very short video, we are going to be going over using the data profile dashboards. I'm Dr. Michelle Fernandez Gabilondo with the Association of Clinicians for the Underserved, and we're just going to give you a general overview of what the ACU data profile dashboards are, how you can utilize them, and then contact information if you need to reach out to us because you require any more technical assistance or have any other questions. So let's go ahead and jump in and get started. So, we're here today with the Association of Clinicians for the Underserved. We were started a little or over 25 years ago by National Health Service Corps alumni. And we have a lot of different types of programming that is really there to support clinicians and that access to care. One of our areas of expertise is workforce, and especially when we look at the recruitment and retention of workforce in community health centers. And that's what we're going to be focusing on today with our data profile dashboards, because all of the data is specific to community health centers and can also be accessed by primary care associations. So let's go ahead and jump right in. So at ACU, we talk about core components. And what does that mean? So we have these 8 key areas that are all about what makes up a high functioning health center. And they don't exist in a silo, they really all work together. But as you can see, the one highlighted here is the data informed workforce plan, which honestly really informs every other aspect of these core components. And any workforce strategy that you're putting forth when you're looking at how are we retaining staff, how are we recruiting them, how are we developing, engaging staff satisfaction, anything of that nature should really be grounded in strong data principles, and that you have really done the assessment, collected the information that will help tell you that story that's backed up with data on where your health center currently stands when it comes to your workforce, and where are some gaps, opportunities, and areas even where you are excelling that could really help support you in those strategies, policies, planning, anything that is related specifically to the workforce in your health center. Another thing that I do want to talk about before we dive a little bit more into the data profile dashboards is the comprehensive workforce plan. So, as you're going through this, all of the work that you're doing, all of the work that you're doing when it comes to your retention strategy, to your recruitment strategy, your development strategy, if you're developing a health professions education training program at your organization, being able to assess what it's happening, because again, you want to really start with data that helps be that springboard to building the rest of the strategies. There's a lot of work, time, investment that goes into that. These are things that you're constantly assessing, making changes as needed, trying to figure out what works, what doesn't. And here is essentially a place where you can put it all together. And this is what we call the comprehensive workforce plan. And we highly recommend, as you're doing all this work, again, the time and the investment that you're making, that you put it all in one place to really streamline the process. And the hope is to really make it easier to access the information you need. And hopefully the data profile dashboards are one of those components. The data that you're receiving from the data profile dashboards could really help inform all of these different sections of the comprehensive workforce plan. So just really wanted to highlight that as we go forward in this short presentation and walk through. Okay. I also like in any presentation that I do to just have common language that we're working with. How are we defining this? So, as I mentioned, one of the core components is the data informed workforce plan. And it really is about using that organizational, human resources, and community data to develop that realistic and dynamic plan for staffing. So the data profile dashboards serve as just one of the many resources you can utilize to really get a sense of what is happening in our health center. Where do we need to make changes? Where are we excelling? And another key piece when it comes to data is, data is numbers. We have the numbers. The numbers are there. But what is the story behind the numbers? And that's so much of what you are also able to hopefully get from these data profile dashboards. It's you're putting the full puzzle together of being able to understand what do we need, where are successes, our opportunities, where are the challenges, all of those things that will help you and support you in building a really strong, comprehensive workforce plan, workforce strategies that will help you keep and bring in those mission-driven staff that are so critical to health centers. I also want to do just a general overview of what are the data profile dashboards? How do they work and what are you getting from them? So first and foremost, as I said, data is numbers, it's there, but the interactivity and data visualization is so critical. It helps people to first and foremost better understand these data components, if they're not someone who has worked with data previously. And the good thing with the data profile dashboards is that it includes interactive maps, charts, graphs. We use a program called Tableau to bring in that interactivity and to have the visualization of the data. So we hope that it gives you the ability to really take it, understand the context of the data, be able to further interpret what it means. You can drill down to the different data elements, service area characteristics. What this is trying to tell you is this data point is not just a number, it's a piece of your story. So what does this story tell you? And one of the examples that I use when I talk about this idea of story is we do one-on-one TA with health centers who request like, hey, can we go through our data profile dashboards a little bit deeper to better understand what we're seeing and how we can use these numbers. There was a health center we were working with, and as we were doing the walkthrough for them, one of the metrics that we talked about is compensation. And they realized looking across the spectrum of compensation, and this is something that they had worked really hard on in their health center to ensure that they were competitive when it came to their compensation, but they didn't realize until they went into the data profile dashboards that they were actually up in like the 90th percentile when it came to compensation, that all of that hard work really was critical. So again, that's that piece of that story of, wow, we have put in all of this time, this effort to make these changes. It is paying off. We're actually now seeing it in the data. And what we can do is then utilize that to really communicate with our current staff about this as a retention tool, but also put it out there when we're marketing for new job announcements, for new positions, to let people know, where we stand when it comes to compensation as a recruitment tool. So again, this is what I mean when I say using data for storytelling is taking all of these different elements, putting it together to really get a sense of where is our health center currently when it comes to workforce strategies. You can compare the data within the data profile dashboards across other similar types of health centers, different size health centers, geographical area. So you're looking at states, regions, national. It can be a very, very powerful tool to help you understand not just where you stand as a health center, but how do you look in comparison to all of the other different organizations and health centers around the country? And one is not good or bad. Like all of the data that we're looking at, there is no specific, like if you're in the higher end, that's a good thing. If you're in the lower end, that's a bad thing. But it's just helping you compare and understand where your health center is currently at. You can view your own trends. As I said, compare across states, multiple states, national averages. And another key thing, while the data of the data profile dashboards are specific to health centers, primary care associations, or PCAs are also able to get access. And for PCAs, for you, the value behind this is you're able to understand where the health centers in your state or in your region currently stand as it comes to workforce, specifically recruitment and retention. It helps you figure out, do we need training in certain areas? Do we need more technical assistance for some of our health centers? So the goal is to really utilize the data to best support health centers in the way that they need to be able to recruit, retain, and engage a strong mission-driven workforce. So, in these next few slides, what I want to look at are these various questions and the different measures that we have in the data profile dashboard. So, when you go into the data profile dashboards for the first time, you may just go into it and you're like, I just kind of want to click around, see what it is, but highly recommend that you come with some questions in mind. So this is where you're looking at things like how pressured is the environment? Does it impact job satisfaction? What are effective team structures, support systems? The ability and scope of practice that each staff member may have. Do people have the resources that they need to do their job? What is the broader access picture? Do the patients have access to the health center, or is it overwhelming for the providers? All of these things, these are questions you want to ask. So you want to come into the data profile dashboards really specifically looking at what do we want to know? And in many ways, already assessed a lot of it to get a better sense of where you currently stand and that you can have those questions answered through these different measures. So what I did in these next few slides is I just pulled some of those questions that we just mentioned and then just put out just the specific measures that can help you address those questions. So when we're looking at a pressured environment, job satisfaction, work-life integration, some of the measures that may help you understand where your health center currently stands are, for example, patient panel per medical provider for full-time equivalents. That is, are providers overwhelmed? Are they seeing too many patients? And if that's the case, does it make sense to then recruit more support staff? So staff like medical assistants, all of these numbers, that's exactly what we're trying to get across to you. And then you're building that data storytelling behind it. Other measures that may help answer these questions are visits per full-time equivalent for primary care providers, percentage of virtual visits for mental health providers. Again, how much is being put on our providers? Do they need more assistance? Are they excelling at what they're doing? Because again, looking at data is not just looking at where the gaps are, but it's also looking at where we excelling and doing a really good job. And that's what the data profile dashboards hopefully will give you a better understanding and a sense of where you currently stand. We're also looking at questions, is there an effective team structure? Is there a supportive system? In order for people to really feel comfortable in their roles, they have to have the right supports. They have to have the right tools, the right training, the right people working with them. So this is what these measures are looking at. Also the question, does the organizational norms encourage that multi-team approach? Again, are the providers, and not solely even the providers, but are the people who work in your health center adequately supported for what they need? So here's where we're looking at things of percentage of non-physician providers, and that's really helpful for the support that comes with those who are physician providers. Primary care clinical support ratios, dental clinical support ratios. Again, we're looking at that support piece to ensure that anybody who's a provider, a physician, a clinician, regardless of the role that they play, that they're adequately being supported in their job. We're also looking at questions at, what resources does your health center have to attract and keep good staff? That's really critically important. So we're looking at things as, for example, the ratio of average pay per medical full-time equivalents to the average for the mix, or regional price parity index. So this is where we're looking at costs of living, percentage of expenses. We really wanted to drill down into these pieces to get a better sense of, are the resources there to attract and keep good staff? And if not, it will give you that data to go back and say, okay, where can we make these adjustments? Where can we invest our time and our efforts in the most efficient way, but also that it is a sustainable way to move forward and support the workforce? What is the broader access? This is really important. Are there enough physicians, providers, primary care MDs, DOs, specialists, the National Health Service Corps placement, their vacancies, dental staff, mental health staff? Is there enough to support the patient population in your community? And that's really important because, one, it's going to indicate, do you need to hire more individuals? But also, if there really are not enough providers in that area, this is where you may see things such as burnout, overwhelming caseloads, patient panels. So again, the data here is just one piece of the whole puzzle. It's a number. It's showing you a number, and it's showing how that number compares across the state, multi-states, the whole nation. But then you need to take that and really understand what is happening in your community, what is happening in your health center, and how can you make the needed changes to better support a strong workforce that will be able to offer those services to the patients and to the community. So as we begin to wrap up today, we did want to also show you, what does the data profiles look like? So when you log in, this is essentially what the page is going to look at. I know there's a lot on here, but you can hover over everything. You can click on everything. It'll give you further explanations. And as you can see at the bottom, these are the different measure titles, and they're divided whether they're recruitment related or retention related. So what is going to happen is you kind of, you hover around, you look at different things, you start clicking, and you're going to get this pop-up. And the pop-up, this is where it's going to give you a description of exactly what is this measure, why is it included, where does your health center fall across different averages, so national or state averages. So again, it's that springboard, that starting point to understanding the full scope of recruitment, retention, and other workforce specialties such as engagement, development, health professions, education, training, and the way that you're strategizing across those issues. But this is just a very quick high-level snapshot of what the data profile dashboards actually look like. This is another view of it. And as I had said, you see the different measure titles, and they are divided by being recruitment related or retention related. I do also want to flag that year to year, for a multitude of reasons, some of these measures may change. So for example, there may be some data sets that are no longer available. So we always make sure to have the latest data that is available. And you're also going to be able to see the comparison, as you can see here, through 3 report years. So the current year, the prior year, and 2 years prior, so that you can also do a good comparison of seeing, oh, wow, yeah, we really have improved in this, or we still have area for improvement. This is a key focus area for us. So let's go ahead and highlight that and work with that. I also want to point out that the different highlights of the blue, all that it's saying is that you're either really, when you look at that curve of either on the higher end or the lower end, one is not better than the other. It's simply just looking at the curve itself of where your health center stands when it comes to that data point. There's also another page that you have access to where you can build graphs and you can really modify it for what you want. So if you see this top part of how you're filtering, you're looking at different types of health centers. Is it urban? Is it rural? The medical patients, and you can make the changes that you need. So then the graphs automatically adjust to show you the data that you are hoping to get. And again, it just helps visualize it in different ways. We're all different types of learners. So we just wanted to give people as many options as possible. And then to end today's recording, I do want to just let you know, how can you access the data profile dashboards? We went through a lot of information on the why, how to use it, but then how do you actually access it? So we produce them on a yearly basis, usually distributed in May and June. Our most recent data profile dashboards came out in May of this year, May 2026, and they are sent, access to the data profile dashboards are sent to every health center CEO or executive director. Now, this is important because this is part of our data use agreement. So we are only able to send it to the CEO or the executive director. So if anybody else in HR, or if there's a chief workforce officer, anybody else in the organization who may want access will need to use the CEO's password to get that information. But the CEO, at their discretion, is more than welcome to share that. We just ourselves are not able to do that. When it comes to PCAs having access to the data profile dashboards, they do need to sign a data use agreement. For the health centers, this is really your own data that we're giving back to you that we've analyzed. For the PCAs, it's important that anybody who has access to it signs a data use agreement. And as I mentioned, really, this is about using this information for your comprehensive workforce plan, for your workforce strategies, for recruiting and retaining a strong mission-driven workforce. And then, of course, if either your CEO, executive director, anybody at the PCAs, or even others at health centers have any questions, please contact the absolute wonderful Mariah Blake, who's our Associate Director of Operations and Compliance, and her email is here at mblake@clinicians.org. That's all I have for you today. I just want to say thank you so much. As always, if you have any questions, please feel free to reach out to us. We're always happy to offer any type of technical assistance. And I hope this gave a pretty good overview of what the data profile dashboards are, how can you utilize them, and ways to navigate the Tableau platform. So once again, thank you, and I hope everyone has a wonderful day.